Summer is almost here when we all live in lighter and fewer clothes, and we all look at that problem fat that just won't seem to go away, no matter how much diet and exercise are involved. But there is a fix for that fat. It's liposuction, and has come a long way, and there are now a number of lipo options out there if you're interested. And here to sort it all out for us is Dr. Alberico Sessa from Sarasota Surgical Arts. Good to see you again.
Hi, Heidi.
What is liposuction?
Well, it's exactly what it sounds like. Liposuction is where we infuse the body or the areas with fluid, and then we remove it. Over the last 15 to 20 years, there's been a lot of changes in liposuction. It's become a lot safer. Not that it ever wasn't, but the majority of liposuction can be done under just local anesthesia without the need for anesthesia at all to go to sleep. In the past few years, we've seen the occurrence of something called laser liposuction, as well as ultrasonic liposuction. These are all techniques to help shrink the skin and break up the fat so that it's more easily removed without having it to be a rigorous activity.
Right, okay, so laser, ultrasonic, and also suction assisted. That's the first kind, is that the...
Yeah, that's the kind that's been around all the time. In order to remove the fat, we actually have to take it out under vacuum pressure. We don't just break it apart and then the body reabsorbs it. To a certain extent, that happens anyway. But most of it, especially in bulkier procedures, it has to be suctioned out.
All right, now what about the effectiveness of it? Should anyone just go and have lipo and then is it gone forever, or is this really a serious situation that you have to consider carefully?
Well, as always, any surgical procedure you have to consider very, very carefully. But it is for just about everyone. We don't recommend liposuction as a weight loss. We recommend it. The ideal patient would be somebody that it's just looking to contour certain areas, maybe their stomach, maybe their thighs, maybe their love handles that they just doesn't go away with exercise or diet. And in those patients, those are the ones that really see the greatest results. If it's just for debulking tissue and just to remove lots of large volumes, we really don't recommend that, and it sort of it's not quite as popular as it was, say, 20 years ago or 25 years ago, where large volume debulking procedures, it's mostly, liposuction has sort of come into the boutique era where, small areas bother people. I want, the curves of my hips to be more pronounced. I want my stomach I want to see the muscles in my stomach more. It's not, you don't have to be fat to have this done. You could have little localized areas, and it's great. And a lot of times we do these procedures just under some simple lidocaine, which is just some numbing medicine.
And what about recovery and how long this lasts?
Well, any type of surgical procedure is going to last for as long as you take care of yourself. But, we would experience the normal postoperative period of 2 to 5 days of some mild bruising, some mild swelling. Depends on the areas that we treat, but if it's just localized small areas, you may experience very little discomfort and very little postoperative edema.
And I thought it was very interesting what you're doing with some of the fat that you suction out, and we're not going to talk about that right now. I'm going to show you that at 6 o'clock. We went to Dr. Sessa's office last week, and we saw some of the interesting things you're doing with fat grafting. So if you want to see that, check that out tonight at 6. And thank you so much for coming on.
Thanks again, Heidi.
And if you'd like more information about this, just go to our website, mysuncoast.com, and click on My Suncoast Health, and that's where you'll see the link to Dr. Sessa's Sarasota Surgical Arts. It's what many people want for Christmas, the gift of youth. And now getting it is easier than ever. At least it'll look that way after you see the doctor. Dr. Alberico Sessa is here to explain. Hello, thank you so much for coming in. We appreciate it.
Thank you for having me.
So it's not so complicated now to get a facelift, is it?
Not as much as it used to be.
And I know you're doing something very special with that. Tell me about it.
Yeah, I'd like to call it, my facelift is I call it the smartlift. And what it is it's a modification of the standard facelift. The standard facelift has been around since the 60s. Most people are afraid of the extended downtime and the swelling and the bruising associated with that. The smartlift is fantastic because it, with minimal incision and scarring, I'm able to do things with the tissues that allow people to recover so much quicker with less bruising. That allows them to get back to their normal activities quicker.
And we're seeing some photos of some before and afters of some of your patients now. So tell us, how much time is involved with something like this?
Well, the great thing about it is it usually takes about 90 minutes to do this surgery. It's very easy to add adjunctive procedures to it. And most people do very, very well with it. A lot of times it's done just under local anesthesia, sometimes with a little bit of light sedation.
And what about recovery?
Recovery is very, very, from what I've heard, very, very, it's very amenable to just a few days to, usually most of what we see is between 5 to 7 days.
That's a big difference. And what about if you don't want even a smart lift, if you don't want any sort of surgery like that at all, what other things can you do?
Well, the gold standard of wrinkle reduction and skin resurfacing, so-called rejuvenate your skin, has always been the carbon dioxide laser, which came out in the early 90s. But that was left people red and unfortunately associated with bruising and swelling for a good two to 3 weeks. Now there's something that just came out that we use in my practice, and it's the carbon dioxide laser, but it's microfractionated. That allows us to the patient to have a much quicker recovery, usually between 3 to 5 days, with very, very similar, if not better, results.
And I know we have a photo of that. John, if our director, if you can put that up. Tell us what we're looking at here. This patient, where do you see the before and after of the laser?
The right-sided pictures are the after photos, and you could really see she had some acne scarring, how nicely it helped her.
And recovery for that?
That was about a week and a half, but she was doing much better at 3 to 4 days afterwards.
Okay, so
Yeah.
it is possible. Dr. Alberico Sessa, thank you so much for coming on. We sure appreciate it.
Pleasure.
So now you know what we all want for Christmas. And if you'd like more information, go to mysuncoast.com and click onto My Suncoast Health. That's where you'll see the website for Dr. They are some of the hottest trends in cosmetic and plastic surgery, and joining us now to tell us all about them is Dr. Alberico Sessa, a Suncoast cosmetic surgeon and one of our My Suncoast Health partners. So good to see you again.
Thank you. Nice to be here.
One of the hottest trends is fat grafting. You were telling me before we went on, there's just been an explosion of literature about it. Tell us.
Yeah. Well, the hottest trends right now are stem cells, and they're finding out that fat cells, believe it or not, could have more stem cells than bone marrow. And we noticed this where we take fat from one part of the body and we place it in another part, hence the word fat grafting. Most of the time it's of the face, in and around the eyes or around the folds around the mouth or the nose. But the thing that we've noticed is that it gives a more youthful appearance to the skin, as well as allowing for more volume.
Now, I know we have a photo of before and after of some fat grafting. John, if you could show that photo. That is not the photo. There's a different one, John. There it is. And that, doctor, tell us about that.
Sure. Well, she was concerned about the lines around her mouth and her nose, as well as the hollowness around her eyes. And we took some fat from another part of her body and we placed it up around her face. And believe it or not, that's only about an hour of minor surgery there, most of the time done under just some local anesthesia.
And what about recovery?
Just, very standard 2 to 3 days of mild bruising, but not very uncomfortable at all.
So this would be in place of a filler such as Juvederm or Restylane. And what about how much longer it lasts versus the fillers?
Well, the nice thing about fat grafting is that you tend to lose a portion of it, but whatever you keep pretty much for your life. As long as it gets revascularized properly, then it's part of your tissue again.
Now, I have a very full face. I would be afraid to go ahead and add any more fat to this face. But I guess if, as you age, you have hollow areas under your eyes, then it would be a good option. Who's a candidate?
Absolutely. Well, pretty much anyone that this particular patient was, believe it or not, she was about 42 or 43 years old. Really, depending on how much sun exposure you have, and your lifestyle depends on how quickly you age. Okay. Some of us do it quicker than others.
Okay. Now, you're also talking about, as a hot trend, fractionated lasers. And
that's right.
To our director, John, if you could show us that other photo now, which shows a fractionated laser patient.
This is a nice result. You know, patients here, we live in a very sunny place, and there's a lot of sun damage. So, you know, I use a carbon dioxide fractionated laser. The procedure usually takes about just under an hour to do a whole face, and we usually just do it under some local anesthesia, some topical.
And what does it do?
Well, what it does is it resurfaces your skin. It's really my primary focus for wrinkle reduction. If someone has wrinkles around their eyes or around their face or on their cheeks, this is the main thing that I recommend to them in terms of a more youthful appearance to their skin, regaining collagen.
Now, lasers have been around for a while, but this one is different. Tell us how.
Well, carbon dioxide laser came around in the early 90s, and it was touted as sort of the gold standard of laser and skin resurfacing. But as time progressed, the downtime associated with just ablative treatments was a little bit too long, and patients didn't appreciate it. So the technology evolved to where it is now, where it's fractionated, where it just comes out speckled on your face. But what that allows is your body to regenerate and get back to your levels preoperatively at a quicker pace.
It's renewing the cells?
Well, it's not so much renewing them, it sort of jump starts them, it excites them to sort of turn over more collagen and build more collagen quickly.
Terrific. Well, thank you so much, Dr. Alberico Sessa.
Nice being here.
Good to see you again, and you'll be back, I know, and if you'd like more information before then, just go to our website, mysuncoast.com, click on My Suncoast Health, and that's where you'll find the website for Dr. Sessa. And now let's go to Chief Meteorologist Bob Harrigan. Bob?
Fill her up. You may hear friends joke about that as they go for facial filler treatments to get rid of wrinkles and lines. But now there's an alternative to fillers on the Suncoast. ABC 7 medical editor Heidi Godman is here to explain. Heidi?
Filler is that goo people get injected into their faces to fill in the lines around the mouth, nose, eyes, even plump up the lips. It comes in a number of thicknesses, and while it really does work, it's just temporary. But there is an alternative, and to find it, look no further than your belly. It's fat grafting. Doctors now using a patient's own fat to get rid of wrinkles in the face or bring back sunken areas. The fat is harvested with a little liposuction from the patient's thighs or tummy. And we watched Dr. Al Sessa sculpting one woman's face after he'd just collected fat from her belly. He injected the fat into the deep folds around her nose and mouth. And he says the benefit of using fat instead of synthetic fillers is lasting power. Synthetic fillers last between 6 and 18 months because the body absorbs all of them. But your own fat will last for years and potentially for life, since about 50% of it will become part of your face.
Our body sees it as natural, and it grows blood vessels into that tissue, and it just becomes a tissue transfer.
And since this filler is your own tissue, there are no allergic reactions to it. It all sounded great to Pat O'Fallon, and minutes after her procedure, she was ready to recommend it to her girlfriends.
Because it's improvement, it makes you feel better, look better, it's change for your husband.
Now, as far as recovery, there can be swelling and bruising the first 2 days. As far as the price, fat grafting does cost more than synthetic fillers, between $2,000 and $2,500. Traditional fillers cost about half of that. But again, the fat graft lasts potentially for many years, so the cost savings in the long run is appealing to patients. For more information, just go to our website, mysuncoast.com, and click on to Health Smart.